keeping the heartbeat of the city healthy with health tips and benefits from real doctors in the area. This is Health Help.
Welcome back to Health Help. I'm Jim Perkins with Wellmont Diabetes Treatment Centers, and we're talking diabetes. What we want to talk about today is what is diabetes, what are the types of diabetes, and just we're going to touch on what you can do to control it. Diabetes is a health condition. It is where the sugar, the glucose, builds up in your body. Now in our region, a lot of times people will say, I've got the sugar, or I have a touch of sugar, or I have a little sugar. They really mean glucose, and sugar builds up in the blood system, and that is when you have diabetes. It's a lifelong condition. High levels of glucose damage the blood vessels, it damages the nerves, and it damages the organs, thus the long-term effects of diabetes. And we're going to talk about this later as well, but if you have diabetes, you have a 2 to 4 times greater risk of heart attack. You have a 2 to 4 times greater risk of stroke. It's the adult blindness. It's the leading cause of adult blindness. It's the leading cause of lower limb amputations that are non-traumatic. So the nervous system damage, this damage to the organs is one of the conditions of diabetes. What do? You want to prevent high sugar. You want to prevent those complications. Now, the types of diabetes. You've all heard of type 1 diabetes. Years ago, we used to call this juvenile diabetes. At an earlier show, I talked about Gary Hall. Gary Hall was in his 20s when he was diagnosed with diabetes. Just a couple of weeks ago, we saw someone coming into the center that was 31 years old that was newly diagnosed with type 1 diabetes. Diabetes is when the pancreas makes no insulin. Insulin helps control blood sugar. Remember earlier we talked about if blood sugar is high, your insulin is not controlling it. So that is type 1 diabetes. Your pancreas does not make insulin. You have to have insulin to live because that insulin controls your blood sugar. How do you control it? If you have type 1 diabetes, there's really only one way. That is with insulin. And those insulin injections can come in the form of needles, insulin pens, or an insulin pump, which we'll talk about again later. Now, about 10% of our population has type 1 diabetes. And when you see people with type 1 diabetes, some of the symptoms, they're hungry all the time, they're thirsty all the time, they're very, very tired and fatigued. They have rapid weight loss, uncontrolled urination. What do you do if you have that? Well, you have to have insulin to live, but you also need to get on an exercise plan and a meal plan, and you need, very, very important, you need to monitor your blood glucose on a very, very, very tight schedule. Now, that's 10% of our population. So you think, well, gosh, 10% of our population, or 10% of the diabetes out there, that's not a whole lot. 90% of the diabetes that you see out there, the epidemic that we see in our country now is called type 2 diabetes. Type 2 diabetes used to be called adult onset. Now, that's kind of a misnomer anymore, and I'm going to tell you a little story. There's a doctor that I know who told me, he said, a month ago I had a 55-year-old grandmother come into my office and I diagnosed her with type 2 diabetes. 2 weeks after that, her 35-year-old daughter came into my office and I diagnosed her with type 2 diabetes. Last week, the 15-year-old granddaughter came into my office and I diagnosed her with type 2 diabetes. This is a true story. Diabetes is hereditary. We see that a lot, but we're seeing more and more and more children and adolescents with type 2 diabetes. There are parts of our country, Charlotte, North Carolina, for example, years ago, the most rapidly growing segment for people with type 2 diabetes was adolescents. So it's very sad, but it's true. In our region, you have seen the growth of type 2 diabetes and the growth of childhood obesity. As obesity goes, so does childhood diabetes. So, it used to be called adult onset, not so much anymore. It's also a medical condition. It is where your pancreas doesn't make enough insulin, or the insulin that it makes is not being used appropriately. This is when you see folks, again, they're very tired, they're thirsty, some of the same symptoms, but instead of being relatively thin, as a stereotypical type 1 is, they usually are a little heavier. Controlling type 2 diabetes can be done with medication. It can be done with insulin at times if it's advanced enough, but mainly it's what we talked about earlier. You embrace it, you make lifestyle changes, you can learn to live with it, and you can control it. So some of the lifestyle changes may be eating, nutrition-wise. It might be exercise or physical activity. You also want to make sure that you monitor, just like you do with type 1 diabetes. Type 2 diabetes, once you have it, you will always have it. Now, we talked about earlier prediabetes. Prediabetes, 86 million people in our country have it. Where diabetes, once you're diagnosed with diabetes, you will always have diabetes. It doesn't have to be uncontrolled, it can be controlled. But prediabetes, the good thing about it, if we can say something good about a disease that has diabetes as part of it, is the fact that you can prevent diabetes if you diagnose it early enough and if you take control of it. So that's the good thing about prediabetes. It can be controlled, you can prevent long-term diabetes. The other type of diabetes that we see is gestational. That is where someone is pregnant. Before they give birth, they have gestational diabetes, so they have diabetes, high blood sugar, low blood sugar, those symptoms during their pregnancy. Most of the time it goes away after they have delivered, but they are at higher risk to develop type 2 diabetes as years go by. That's what we call gestational diabetes. You have type 1 and you have type 2. All of those can be helped by embracing it and learning to live with it and making lifestyle changes necessary to live a very full, normal life with diabetes. I'm Jim Perkins, Talking Health.